Hello, everybody. Let's see if I can see here. We'll just give a couple of minutes for some others to jump on. Everybody doing okay today? Had a good weekend? All right. Okay, so I'll go ahead and get started. I wanted to do a Medical Monday today on someone specific asked me about Alzheimer's disease. So I wanted to talk just briefly about it. The specialist that you would want to see in reference to any neurological disorders is going to be a neurologist. So if anybody, just as a disclaimer, I am not a neurologist. I don't specialize in neurology. But if you or you know someone that may be dealing with anything with the brain, a neurologist is one you want to see. Hey D girl, how you doing, girl? So basically I just wanted to jump just briefly about memory loss. Memory loss can come from, there's a variety of causes. But if you are someone that's young and pretty active, but you're having issues with maybe some depression or anxiety, memory loss can be attached to those issues. So if you're somebody who you've known that you've been down in the dumps for the last couple of weeks or last couple of months, and you're not on any medications or in any counseling, you have a history of depression, it is recommended that you go ahead and treat that depression, because what is happening is the chemical imbalances that you have with the depression or anxiety can lead to the memory loss. And I mean, I'm talking like things, something such as like forgetting a restaurant or forgetting which way to go on the highway. If you notice that everything has been fine and then all of a sudden you can't remember things and you know that you've been down in the dumps, definitely go ahead and seek help. We want to address any type of disorder with the mind to prevent memory loss from getting worse. They do have, I mean, there is a real thing called mommy brain where once you have a kid, things kind of go. But I think it's more related to your anxiety because you're constantly on the go. You're constantly thinking about a lot of things. And so we tend to just forget things that aren't in our everyday lives, such as certain restaurants or certain highways we may not take every day. But in reference to, so just jumping into Alzheimer's disease, Alzheimer's is just a type of, so dementia is like the overall name of memory loss, cognitive function decline, but Alzheimer's is the most common that we hear about. It typically affects our elderly population. I can't give an age on it because everybody is different. However, it has been seen to be linked via genetics. So sometimes if mom or dad had it, then more than likely you may get it. And I'm not saying it's you, but it can trickle down the family line. But with Alzheimer's disease, what I just kind of really want to pinpoint is these patients have really no control over what's going on. And I don't know if you've ever seen a dementia patient, but just like if you see on a movie how patients seem, they're just irate. Their behavior is just out of control. They're not eating. They're not sleeping. Those things, this is real life. These things really do happen. But what I just want to encourage all of you, those who may be dealing with patients or parents with Alzheimer's or family members, is to seek these groups. They have Alzheimer's groups out there. They have a hotline, and I'll give that information before I finish, because I really want you guys to understand and to get into trying to understand what these patients are really going through. And it's very, very hard for a family member to watch a demented patient go from, they were doing everything for themselves a month ago, and then all of a sudden there's a decline. And what happens is it's called degenerative change in the brain, where over time, it's kind of like sometimes it's a slow, a slow change over time, and then other times it is more rapid. But once we start to kind of forget things, and then it just kind of gets worse. But a key to that is make sure, don't just assume somebody's going or is becoming demented or that this is a diagnosis of dementia. Make sure that they are being checked for any vitamin deficiencies. And I talked about this before on a live. If you are vitamin D deficient, then you have all your other chemicals in your brain are depleted as well. If everything's depleted, then your brain's not going to function as well. So please be checked for vitamin deficiencies before moving on to something as serious as dementia. Now, there are medications. Sorry. My live just went down. Sorry, I had a phone call. There are medications to help with memory loss before a patient gets to a severe stage of dementia. So if you are, if you're noticing that mom or dad or uncle, they're starting to forget more things, they're losing their keys, they don't really know your name anymore, but they come right back. This is the time where you want to go ahead and seek help for them, because at this point, this is where we can potentially get on some medication or do some herbal remedies. I honestly don't know any herbal remedies off the top of my head that could help with that, but I'm sure there are some out there. But this is the time where you would want them to be assessed by a neurologist to potentially get on a medication to help prolong the memory loss. So like you want to kind of drag it out as long as possible. You can't prevent memory loss from happening or getting worse with dementia, because unfortunately it's not a fun disease or disorder to watch, but you can prolong, I guess, give the person more time. So I do recommend, if you're noticing this in your family members or friends, please speak out and encourage them to be seen and get seen by a neurologist so that they can assess them for any dementia or Alzheimer's, is what we're talking about. But go ahead and get assessed for that. And that way they can get them on medications that they need and give you insight or education about it. But I'm gonna go ahead and give you guys, so the Alzheimer's Association helpline is 1-800-272-3900. And I'll post that in the comments. They do have a website as well. And there are plenty of support groups. You can probably hop on Facebook and find a support group for Alzheimer's, because this is one of the very, very hard things to digest as a child who's watching a parent or grandparent go through this. But signs and symptoms of Alzheimer's. So again, with the memory loss, forgetting things, and once all the vitamin deficiencies have been ruled out, or a big one, urinary tract infections. Urinary tract infections in our elderly patients are so common, but it's so misdiagnosed because we assume that grandma she's just more confused. And I say grandma, forgive me if you may have an aunt. But if you're noticing that an elderly patient or an older patient is more confused, they don't know who you are anymore, they're not eating, they're not drinking, check a urine. Please push. If these patients are in nursing homes or assisted living, providers have a lot of patients, and it's not an excuse, but they have a lot of patients. And I am encouraging all of you, if you notice that something's wrong with mom, dad, aunt, brother, sister, you ask for a urine, okay? Get the urine checked, because if there is a urinary tract infection, this can cause some acute confusion. If this patient has a urinary tract infection for a very, very long time, this is what leads to what we call sepsis, which is where the bacteria gets in the blood and it just kind of makes the whole body toxic. And most of these elderly patients don't make it. But if you can think about a patient who doesn't really know when they have to use the restroom, they're not going to be able to tell you about urinary symptoms. And unfortunately, there are nursing homes where we don't really have the best care. And if these CNAs or nurses aren't catching on to a foul smelling odor in the urine, then they're not going to check for a urinary tract infection. And like I said, it's, I hate, healthcare is now like a production line to me, and I really don't like it. But if you're a family member or a friend, and you're realizing that, hey, something is wrong with my aunt or my grandmother, I need you guys to do more than just, chalk it up to memory loss or dementia. Something really is going on. Make sure they check a urine. That's very, very important. And as far as like changes in their mood, unfortunately, it's really, really not a whole lot that a provider can do. There are meds out there to help with aggression. There's meds out there to help these patients sleep, to get some rest. But the biggest thing is to make sure you keep a patient with Alzheimer's on a schedule, in a structured environment, whether they go to adult daycare or if they're home with you, to just keep them on routine. A lot of times that they have to stay busy. They need to stay busy with the mind. And even prior to being diagnosed with dementia, once you start getting older and not moving or thinking as much, critical thinking as much, and it's encouraged that you do word puzzles, coloring, a lot of things to keep the mind going. And that's kind of what helps. But exercising, eating right, making sure that your diet is full of those the good vitamins that we need. So your vitamin D, your vitamin C, those things, calcium, those things are needed to help keep you functioning. So I think that's kind of really all. So watching a patient with Alzheimer's is very, very difficult. Unfortunately, like I said, it's just a disease that gets worse. It does get worse. And again, try not to, I won't say don't take it personal. Try not to take it so personal as a family member, because you have to understand that it's the disease talking and not the patient. So the person that was once grandma to you, loving, is now mean to you and doesn't know who you are. Find ways to cope with that, because unfortunately it does not get a whole lot better. And again, just try to remember that they don't know who you are, and they're just different. Their mind is different, and it's unfortunate, this nasty disease is taking over. And so, give yourself some grace to be upset, but learn to cope with this disease. And if that requires going to a support group and just finding people who you can relate to and just talking through this, it's important. It's important because this disease takes, it affects a lot of us. I myself have had family members diagnosed with Alzheimer's, and it's just not fun because you don't recognize this patient. And just my personal opinion, when you see mom or dad or, elderly grandma, aunts and uncles start to not eat anymore or drink, they start to lose weight. Sometimes, and it's been studied, but sometimes these patients get tired. They get tired. And I know we as the human flesh, we get selfish. We don't want to let our family members or friends go, but they get tired of living in this body, this shell that they don't even know who they are. They can't even remember to do certain things for themselves. So sometimes that I don't want to eat anymore, or I don't, just wanting to eat sweets. This is my opinion. Let the 85-year-old eat sweets. We can't force string beans down. They've lived this long life. And if they just want cake, give them the cake, as long as they're eating something. But that's my personal opinion. I know some people argue with that. But just be mindful that, them trying to decline or stepping back or not, not wanting to indulge in things that can keep them healthy or increase their appetite or, whatever the case may be. Sometimes they just in their mind have decided that, they're tired. And some are ready to leave this earth. So it's just a hard thing to cope with. It is very, very hard, but I just want you guys to be aware that it's a disease that it's a nasty one. The goal is to try to catch it early when it starts happening. Let's go ahead and try to get these patients on meds, but just be mindful that meds aren't magic. They are not magic. And you may get to a point, or the patient may get to a point where it's not working or, any longer for them, and that they still end up declining, because again, it's a progressive disease. We just can't put a time on the decline. So I think that's really it. I just want to encourage all of you. Again, let me go ahead and put in the comments to seek help, ask questions. If you guys, if a patient's in a nursing home and having issues, like I said, acute confusion. You're like, who is this? What's going on with mom? Why is her clothes on backwards? Why is she putting on a sweatshirt and it's 80 degrees outside? Notice those things, even if they're not in a nursing facility. If you're noticing that mom or dad is just doing things that just don't seem right, this is the time to go ahead. Don't push it off. Make sure you're checked for vitamin deficiencies. They're checked for vitamin deficiencies, urinary tract infections for sure. And then a trip to the neurologist, because they can do a brain scan and see kind of, what's going on with the actual brain itself. So with that being said, let me go ahead and type in here the helpline. information. If you guys have any questions, let me know. I know this was kind of short and sweet. I just kind of wanted you guys to be aware that this is something that is very hard to deal with. I do understand that. So that's the helpline. And then let me go ahead and add the website that you guys can go and read about Alzheimer's some more. And then it's Alzheimer's Association is a patient support group. Alzheimer's. Okay, perfect. I think, okay, so I'm gonna go back up and read the comments. I'm sorry, it says Facebook user, I am coping with it with my mom. Yes, yes. I am sending you all the strength your way. Unfortunately, I can't see your name, so I apologize. But I am sending the strength your way. I encourage you to reach out to your support groups because it is hard. This is hard. And it's not, it's not easy watching your loved one kind of just decline in front of your eyes. I empathize. I've been there. I've seen it. And just being in nursing, it is a tad bit easier. It's not a whole lot easy, but it's a tad bit easier to understand how these patients really feel because, I've been there where I've heard them say, I'm tired, I don't want to be here anymore. I'm ready to go, and I don't know who I am. So that's why it's just a little easier for me to empathize. And that's why I just kind of encourage all of you to just learn how to cope. Don't make it unhealthy. It has to be a healthy coping mechanism because this disease just kind of generally gets worse. But I hope you have the support you need, the family support, rotating between family members because caregiver strain. Oh my God, I'm glad I'm saying this. Caregiver strain is so real, y'all. You need therapy as a caregiver because it takes everything from you, everything, because you're giving your all to this person who you love. So I encourage you guys to have a backup system. I know, and it's sad because I know in South Carolina, they just make it very hard for you to get help in the home. But if you can afford help, get some help. If you don't have anybody, there is something called, I think it's called community long-term care. Don't quote me on it, but here in South Carolina, community long-term care, they do have people who help come in the home and help. You can't do it all. One person cannot do it all. You will burn yourself out and you will have nothing for yourself. So please try to get help. Something called respite care. Some nursing homes allow you to take your I keep saying patient, your family member or friend, and take them there for X amount of days, for X amount of dollars, or insurance may cover it. I don't know all of that. So call your insurance company or their insurance company to see what they cover, but it's called respite care where you can get a break. Or they may have respite care workers. So I advise you guys to dig into your benefits or dig into your loved ones' benefits or families and see what can you get? What help can you get? Because you can't do it all. You can't you can't do so much for yourself where you cause yourself to stroke out. Because then who's gonna help mama? Nobody can help mama if you stroke out. So please seek help, extra help. I'm not just talking about, getting mom and dad to the doctor. I'm talking help to come in the house and relieve you. Who can help cook? Who can get a meal? Get the church involved. You need help, as far as getting meals and counseling and all of that stuff. That's what these resources are here for. We just have to ask for those things. So again, I send my well wishes to you and plenty of strength. Okay. One day at a time. Brianna, thank you so much. We've been back and forth with Dad last few years to make sure brain cancer is not returned. So this is very informative. I appreciate it. You know what, Bri? Listen. I gotta reach out to you for that. But yes, please just make sure you're watching for those signs. Again, I know he's probably seeing a neurologist, so it's good that he's in there. But any change, any like sudden alteration, and that you're like, hey, something's wrong. Be vocal and advocate. Okay, that's the biggest word here is avocation. I think a lot of times we just don't ask the right questions, and sometimes they act like they don't want to hear us either. So we can be vocal, and we can go to whoever we need to go to. If we need another opinion, we need to move on to the next person, because somebody gonna listen. We know our bodies, and we know our family members more than a professional. And I am a healthcare professional, so I can say that. We listen to patients. We don't typically we can't listen to lab work all the time, or look at lab work and say, hey, this is what's going on. We need to listen to those around us as well. So I got to reach out to you though about that. I hope he's doing well though. Yes, it's hard to see someone change overnight. It is. It is. But again, and I'm not saying don't take it personal, because it's very personal, but try to, hold on to those good memories, that you do have, and just understand any type of, aggression or backlash you're getting. Don't feel like it's your fault, because it's not your fault that these patients or your family members going through this. It is not your fault. So try not to hold on to that. But definitely, I just encourage you to do the best you can. That's all you can do. One day at a time, do the best you can. You're one person. And I hope you have a village behind you to help, just share the love, because it's a lot caring for somebody. Okay. So thank y'all for sharing, and I appreciate those who are watching. I hope this was very informative. Again, I'm not a neurologist, nor do I specialize in neurology. So I just wanted to make this short and sweet, and just really encourage you guys to get the support you need, get the resources you need to help these patients who may have Alzheimer's, or family members who may be dealing with this issue. It affects a lot of our homes. So I just wanted you guys to be aware that it's okay. It's okay to ask for help. It's okay to reach out. But if you guys have any other questions, my information's at the bottom. I have put in the comments the website and the hotline information, or helpline information, if you guys are needing any additional assistance. And again, it's a neurologist. If you're dealing with memory loss or any issues with the brain, a neurologist is the specialist to see. All right. I hope you guys enjoy the rest of your Monday. And if you have any additional questions, please feel free to reach out. All right. Y'all take care. And thanks again.